That's when we started talking about the lean process, and so the initial thing was for Ludi and some of the nurses to go to the class, and so then we would implement that as far as our supplies and our medications. But then when the three of us started talking about it, we saw that we can kind of use that concept and kind of lean the whole clinic and do different things in the exam rooms and even our supplies for the PSS staff. And we just started using lean, and we call it the lean.
We did a lot of the just basically looking to see the supplies that we used on a daily basis and trying to go by Adam's presentation as far as leaning the clinic, as far as doing just keeping stuff on hand for about a 2-week period. When we started in here, I mean, we had an abundance, as Ms. Kathy said. I think I had to send out like 4, or Kathy Angel sent out like 4 emails giving things away, and then still we donated things because we had so much.
We lean time. We weren't wasting time when we were ordering, because now what we did was we started putting our product numbers, who they came from. Our mids and our maxes really were what season are we in right now? We're in the 6th season, so we changed that. We can change the mins and max so that it helps us. So we're not wasting time searching for numbers. Each time we get something new, as you can see, like these right here, we're going to get another one printed out. We're going to have the numbers on there. Then it evolved to having pictures next to them, so that if somebody, I'm not a nurse, I didn't know what a lot of this stuff was, so I needed it for me. But the pictures help out a whole lot, so that everybody knows this is what goes here, and so it evolves to what it is today.
And as we pointed out, everything is in its place. It's labeled. You have your supply list that has expirations. They don't move. So if a physician needs to go in, if the nurse is not in here yet, he can easily go in here, or she, and they don't have to be pulling the drawer and looking for things. Everything is in its place.
From my perspective, having that eye contact and not moving away and looking for things around, it looks really sloppy when the patient is and you're trying to look around for things. It's not the right message. So the whole idea is the whole team is working together, and I know where things are, my team knows where the things are. That gives the positive impression to the patient group, of course. No doubt about that.
So the lean process as a whole has majorly impacted our thought process, not just how we have the clinic set up, but how we look at things. You know, we're looking at things to make sure they're efficient, it's cost effective, and that it's going to be a positive impact. And so we just kind of look at everything from that perspective. So we don't change major process, but we look at different things, how we can tweak it to make it that much better.
We've leaned the clinic because of the patient. We save time. We know where everything is. We're saving money so that we can better our clinic and for them, and because that's what we're here for. We're here for them, for our patients, and so everything just ties back to them. The lean project's a great thing to have in your clinic. But when you take care of the number one most important thing in your clinic, and that's your patient, and you can tie all of this to it,
right? It
just brings that team together. It brings everybody working together to say, hey, listen, we did this, and we want to give it to you now. It's awesome.
Totally.